Hey everyone, Dr. David Wank here from Shortles Design, and I wanted to take a minute to go over HIPAA compliant forms and how they work. So, in order for a form to be HIPAA compliant, what has to happen is it has to be submitted in a way that's encrypted and meets, the HIPAA standard, security standard, privacy standard, and have end-to-end encryption. That's what you see here, from the form to where you're reading the email. Now, there's a misconception that Gmail is HIPAA compliant. Gmail is not HIPAA compliant. Google Workspace can be HIPAA compliant, but just by signing the BAA, the Business Associate Agreement, doesn't make it compliant. There's still things you have to go through. You could sign a BAA and then go ahead and open up a secure email on an open network at Starbucks, which obviously you're not going to do. So what happens is, with the way it works with HIPAA compliant forms, think about it like when you go to the doctor and your physician has to send you lab results. They're not just going to email you lab results. They'll email you a notification that says your lab results are here. You got to click the button and log into the portal. That's how it works with HIPAA compliant forms. So over here, here's your website, and we have code that we put in that's taken care of HIPAA wise. Code goes in, patient submits the form, or the contact submits the form. It depends what kind of form it is. Doesn't really matter. Encrypted, and then it goes to the portal, our secure portal that we use for you to read it. Now, you get a notification that's not HIPAA required because it's saying, hey, doc, you've got a form to go check, just like the doctor. You've got a new lab result. Click here, log into the portal, read the data. Now, the problem is it's a pain in the neck to have to log in to check the data, but that is what HIPAA wants. HIPAA wants, the government wants it to be a pain in the neck to look at personal data, and that's the problem. So, the question becomes as well, obviously a health history form, certainly HIPAA. What about a contact form? And that's really where there's a really big gray line or a gray area, because the HIPAA compliant form, if someone types in, David Wank, David W at shortlesdesign.com, I'm curious about dental implants. Is that PHI? Absolutely. But is that covered under HIPAA? Gray area, because we don't have a patient-doctor relationship. If I go to your website as regular, John Doe, and I submit that, is that a HIPAA issue? Hard to tell. I mean, I'm asking about a medical service, a dental service, but we don't have a patient-doctor relationship. And so that's a question. And again, it's a question that you don't want to be on the wrong side of. And that's really the issue. There's no law that says, okay, I mean, there's the HIPAA law. But are they going to come after you for that? Probably not. Is there a risk? Maybe. It's a non-zero risk that you could get in trouble for having a form that's not compliant. Now, obviously, if someone writes, hi, David Wank, here's my email, my phone number. I'm interested in whatever, dental implants. Oh, and I have, high blood pressure and, diabetes and all these other medical conditions. And I take medicine and I'm on blood thinners and I don't know if I can have implants. Now, same question. They've now listed medical information, and certainly that's HIPAA protected, but they submitted it voluntarily. So is that still a HIPAA problem? I don't know. I mean, once you get it, do you have to protect that? Well, if they're not a patient, what's the answer? And now if they are a patient, if a regular patient comes in there and submits that, absolutely an issue. Now, okay, what if you have a form that says, please do not submit secure information, PHI on this form? Does that get you off the hook? I'm not sure. And the lawyers that I've spoken to will tell you, if there's a problem, they're going to say, Dr. Wank, you should have known better. And if it's the other side, they're going to say, well, it said not to submit it. So what if we have a checkbox? And again, can a patient sign away their rights to HIPAA or privacy? If, I've had a patient come in who wanted a post on number 6, and they brought me a pin and I said, this is not a restorable tooth. And they went like this and said, can you use this pin that I brought from home to make the post? I think it'll work. And the answer is no, right? Now, obviously I could say, sure, sign this. Let me try it. You got it in your garage. Let me sterilize it and you sign this waiver. Patient can't sign away their rights for me restoring a canine with a pen from their garage. And so can a patient sign away their rights for you to keep their HIPAA, their personal information private? So that's a decision that you're going to have to make, with your, talk to your attorney or whoever it is that you trust, dental association, legal advice. My recommendation is to go ahead and show HHS that you're making the effort. It's like a lot of other things. It's not going to protect you entirely because, again, the law is a gray area, but if at least you are showing my personal belief as a dentist, as a marketer, not as an attorney, my personal belief is that if you show you're making a concerted effort to take HIPAA seriously, to protect the information, if you were to run into trouble, then I think that you would, hopefully that would look good for you, because that's part of what that is. If you said, well, I don't really care about HIPAA and it's not a big deal, then I think you might have a bigger issue. But if you go through the effort and just show that you're trying to do it, that's something that I think is worth a lot, especially, again, from my anecdotal reading and speaking to HIPAA attorneys about it from what the government's perspective is. So, again, having HIPAA compliant forms, I strongly recommend it. It is a HIPAA gray area, and it's a pain because it's not going to come right to your Gmail. You're going to have to log into a portal to get the information. But again, HIPAA wants to make it difficult to get information, PHI, available and visible, and so that's what we're left to deal with.